It is just a huge honor for me today to have one of the biggest TMJ legends that ever lived on my show. It's Dr. Michael Gelb. He's a highly rated author and speaker on TMJ, sleep apnea, sleep disorders, and chronic headache treatments. After graduating from Columbia University with a DDS degree, he received his MS degree at SUNY Buffalo in Neuromuscular Research. Dr. Gelb went on to become clinical professor at NYU, where he directed the TMJ and Orofacial Pain program. Dr. Gelb provides solutions for dentists to incorporate airway and sleep into their practices. He is also the co-founder of the Foundation of Airway Health and its Airway Summit. Dr. Gelb is the co-author of GASP, Airway Health, The Hidden Path to Wellness, which you can purchase on Amazon. He also maintains a private practice in New York City and White Plains. He has pioneered Airway Centric Medical and Dental education and recently developed the ACG Day-Night Appliance system. When I started this show 1,090 days ago, you were one of the first people I emailed, and it took 3 years before you finally blessed our show, but thank you so much. So I just want to start with one rant, and I don't even want to interrupt you. I just want to let you take it away, but when I talk to millennials, or when I talk to dental students, probably a quarter of our listeners today are still in dental school, and all the rest are under 30. We're probably the two oldest guys that ever listened to a dental podcast ever. They always say the same thing to me, and they're saying this sincerely. This is their question, not mine. They're saying, man, if you listen to 10 endodontists lecture, they don't argue. There's no controversies. You listen to 10 guys making a denture, they don't argue. You listen to 10 oral surgeons, there's almost no arguments. And then you listen to TMJ and occlusion, and they go, it's like 20 different world religions. Why do they feel this way? Like you got an MS in neuromuscular. You know how controversial the different occlusion camps are, neuromuscular versus CR, CO, Pankey, DOS. So my question is, why is it so confusing and controversial and complex?
Yeah, it's a great question, and it's great to be here, Howard. I'd say that it's because it was a religious cult type thing because they really didn't know very much. It was all based on dogma. So they would argue about where is centric relation, where should the jaw be? Should it be up and back? Should it be down and forward? Is neuromuscular? Those guys were bums, and then there's no good. And the CR guys hated the neuromuscular guys. And then there was my dad, and it got very, very controversial. And I think one of the greatest kind of accomplishments or greatest things I've seen in dentistry is that, it was the Hatfields and the McCoys. It was my dad against Pankey, my dad against Dawson. And now I become good friends with Whit Wilkerson from Dawson, and I become friends with Mark Murphy from Pankey. And the only way that we've come together, which is so exciting, is we unify. It's the unifying theory of dentistry. It's about airway. The only thing we all agree upon is that everyone deserves an open airway. Every patient should have an airway. And our feeling is the guys from Pankey, Dawson, LVI, Coy, Spear, airway trumps everything else in dentistry. Airway trumps everything else. So whatever you're learning, whatever you like, you really should learn and should know a little bit about airway, because if you're going to do a full mouth case, and we could talk about this, you got to start with the airway first. The last thing we look at is teeth. So I'm going to make some controversial statements, but one thing that you're going to get agree upon, and I never saw, if you have Coyce and Spear and Pankey and Dawson and LVI all agree on something, and I would hope the Dental Town people, it would be that airway is pretty darn important, and start looking at it, and maybe it'll make things. So, here's my thing. Once I started looking at airway, it did away with a lot of TMJ problems. Then the TMJ wasn't so important anymore. And so the CR guys, they had to stop talking about CR, because the guys that were pushing jaws back, we just got a position paper from the American College of Prosthodontists. You can't keep doing the same bite guard that you and I learned 30 years ago. When I graduated Columbia, 50% of the night guards that are being made every day in this country are actually closing the airway. And I think it's more like 90%. So there's a lot there.
Well, I'm so old. When I graduated from dental school, the Dead Sea was just sick. And hey, when you're listening to Dr. Gelb, I want you to know, this guy, he's been on ABC News, CBS, Chicago Tribune, CNN, Elle, Fox, Fox News, Village, New York Times, The Atlantic. I don't think I think if there's anyone that can agree on anything in TMJ, it's that all American media agrees that you're the expert. So
Thank you.
All those people you listen to, Coy Spear, Panky, Dawson, Dickerson, not any of them have been on 1/3 of that list.
Well, thank you.
If even any on that list. I mean, really, it is an amazing honor. I'm starstruck podcast interview. So, in all seriousness, so when I graduated from University of Missouri Kansas City in 1987, not one time did anyone mention Airway. I mean, I never even heard the word.
No, we never heard it. No one talked about it. No, we didn't know. We didn't know there was an airway. I mean, it was there, but it was an empty space, right, Howard? It was an empty space. It didn't matter. It was empty. So when you did your anatomy exam, it was hard to put a tag on the airway because it's air. And we just never realized that the tongue was so important. So Howie Hinden and I, we wrote this book, GASP, and we talk about Airway Centric. Because I like the concept. We always talk about centric relation, but this concept of airway centric is a new way of thinking in dentistry. Okay, it's not a thing. It's really something that we can teach. It's a device. And so I love talking about airway, and I love talking about airway centric.
Well, talk about GASP. Is that gasping for air? Tell me, what are they going to learn if they buy your book, GASP, Airway Health, The Hidden Path to Wellness, a gazillion 5-star reviews with you and Dr. Howard Hinden?
They're going to learn that airway issues start in the first year of life. So preemies, we're going to start with kids. Everything's evidence-based. We got references on everything. You're going to see that most preemies, anyone born before 34 weeks, 35 weeks, anyone early birth preemie will most likely be a mouth breather and has a high likelihood of developing an airway problem, mouth breathing, snoring, sleep apnea. And you're going to learn early on that it's probably responsible for 60% of people or patients, kids with ADD. And you want to talk about getting kids off of ADD medication and something they probably never needed. We talk about all that, and I think the kids part is particularly passionate about that, and it affects a lot of us. It affects a lot of our kids, our grandkids, and we all know kids that are on meds for that. So it starts with that, and then it goes on to fatigue, this is all lifestyle, Howard. This is why I like talking to Melinda. I'll talk to anyone, but it's about how you feel every day. How's your memory? How well are you performing today? How's the mood of your kids? How about anxiety in children? How about anxiety in college students? So we've got into subjects that I never in a million years thought I'd be talking about. Anxiety, depression, panic attacks, insomnia, performance of all kinds, fatigue, stuff that's really relevant to how you feel. And so GASP takes you through all of that. And then it takes you into older age with, dementia, Alzheimer's, and it links everything back to sleep and the airway. And what you can do about it as a dental team. And by the way, the dentist and the dental team, the assistants and the hygienists, it's run by the dental team, and no one does it as well as we do it. The ENT can't do what we do. The pulmonologist can't do what we do. We love working with the team, but you really need a dentist involved. And we'll even talk about aesthetics in there as well.
Well, let's I'm going to throw a big reality blanket at you. I mean, I know my homies. There's 211,000 Americans living today with a active license to practice dentistry. And when someone comes in with anything to do with TMJ, all they do is the assistant comes in, takes upper lower alginate, they send them to a lab, they make an eye guard, they're cured, they're done, next patient. Do you realize?
Thank you.
What percent of American dentists treat TMJ like that? What would you guess?
90%.
Absolutely.
95%.
So that means 9 out of 10 people. And then what's even tougher is you're talking to all these 30 and under dentists right now, and about a third of them are going to go back home and practice mom and dad. They think their mom and dad, their mom's the best dentist in the world, their dad's the best dentist in the world, and he's going to say that I've done it this way for 30 years. That's what we do. Next patient. How does she go home and tell the love of her life, her mom, who's a dentist, that, okay, there's more to it than upper alginates and a night guard tray for 90% of all TMJ treatments in America today?
Yeah, well, that's a great question. So today we have things that we didn't have 15 years ago. We have cone beams, right? We've got home sleep testing. So first of all, just knowing that half the night guards that you've ever put in, at least half, or the night guard that you may put in tomorrow, or maybe after this podcast, I hope to kind of ruin their thinking, or I want to disrupt the way they think. I don't want them putting in that night guard that they used to put in because they know. I'll ask you a question. Is that night guard opening the airway or closing the airway? And if I told you that half the people that Brux have a sleep apnea or a snoring condition, and maybe their sleep condition is what's making them Brux. You remember years ago, Howard, it was equilibration. If you were a Bruxer, you had to bounce CR, get the balancing, the working, lay the patient back, minor equilibration, or God forbid, a full mouth rehabilitation. And that was the treatment. We actually believed that equilibrating the mouth, full mouth equilibration, would stop clenching. Well, we've come a long way from since then. And we know that it's a stereotype movement disorder. We know it has to do with sleep. We know there's arousals. And so the American College of Prosthodontics has published a position paper, which everyone should read. And they're saying, when you get a patient that has clenching, that has bruxism, it would behoove you. And beyond that, to avoid liability, you should be investigating whether this patient has snoring, mild apnea, moderate apnea, and maybe take a look at their airway. And so we talk about the airway as something that you carry with you 24 hours a day. So if you're going home, if you're a millennial, say, before I make that night guard, why am I making it? And if I'm putting in it, is it opening the airway or is it closing the airway? If you don't know, don't put it in the mouth.
So how does she listen to you and go to the next level?
Well,
give her a stair step. I mean, she does. First of all, she's $400,000 student loans, especially if she went to NYU. What's NYU a year now?
It's probably 125, 100. Yeah, I think
so. So she borrowed the whole thing. It's $500,000 debt. She can't afford to just walk out with $500,000 student loans and go through Coy, Spear, Pinky, Dawson, and Dickerson.
Exactly.
So give her a stair step. How does she go from 25? My mom just takes alginates and sticks in a night guard. And how do I end up being like you someday?
I think it starts with, we're doing a course now, $1 Million Airway. We're doing a 5.5-hour course across the United States. We're not doing a ton of them, but you get started, you go to a study club, you go to a lecture. There's more and more stuff online. You and I are going to do one online. We'll do an hour course where they can learn something about snoring and sleep apnea. And then, you have to, I guess, online learning is the way to go. I mean, I think that's what you and I have been talking about. They come and they spend a day with me. They do a 2-day hands-on course. I mean, I think that's the best way to learn because, Howard, you don't learn this in dental school, unfortunately. Even though it's the right thing to do, they're still not teaching this in dental schools right now. So you've got to learn from someone that you like, that you trust, and just start reading. I'll tell you, though, the book GASP, it's a good start. Just get this book. All of my patients get this book. And then I can recommend other books after that.
Well, first of all, I want to thank the 25,000 dentists who follow me on Twitter. And I know that 85% of my listeners are commuting to work right now. So what I do to help them is I retweet my guest tweet. So I just retweeted your last tweet on, he is on Twitter. He is the Gelb Center, Gelb, G-E-L-B, the Gelb Center. And his last tweet was, the mouth is the entry point, not only for food, but also for bacteria that end up in your gut in both small and large quantities. So was it the only 2 dentists in the family, you and your dad?
Yeah, absolutely. Yeah, my daughter was working here for about a year, helping us with new patients, the phone, treatment coordinator, and hopefully she'll be back in a few years with her own practice.
That is so cute. I love that. All the media talks about the Fortune 500 companies all day long, every day. They don't even employ 12% of Americans. And then small family business, 25 employees or less, 85% of the economy. And it's the family-owned wheat farm, pig farm, dental office that runs America. And that's so cool.
I'm with you.
That's so you think all the camps are now come together because of sleep. But you say some things there I know they're not going to understand. You say airway trumps everything in dentistry, mind and body, medicine and dentistry, day and night, sympathetic and parasympathetic. What do you explain those last two, sympathetic and parasympathetic?
So what happens is when you stop breathing at night, your body's saying to itself, I'm not getting any oxygen. I'm building up CO2. Something bad's gonna happen. And so what happens is your sympathetic nervous system picks up, you get an arousal, you wake up, you release cortisol, and you're just ready to, you have to be revved up because your sympathetic nervous system, fight or flight, is keeping you from dying. And so what happens in the morning, you get up and you're still revved up and your blood pressure goes up, you develop cardiovascular disease. So basically what we're saying is that if you want to integrate mind-body medicine, if you want to integrate everything, everyone talks about the vagus nerve, parasympathetic, people are meditating, people are doing yoga. The way that you can get your nervous system to slow down is just to slow down your breathing. So if you go, Howard, you and I are breathing 16 to 18 times a minute right now. If we would go to 6 to 8 times a minute to breathe, if we would slow our breathing down, 4 in, pause for 2, 4 out, and just take a deep breath while you're driving out there or while you're listening to this, take a deep breath. And what that'll do is that'll help your heart rate variability and it'll stimulate your parasympathetic nervous system. So people are reporting to us that after they've opened the airway, after they're wearing one of these devices at night that opens the airway, they're a lot calmer, they're better focused. So I talk about the nervous system. I talk about the airway day and the airway at night. So I talk about it's as important sometimes to open the airway during the day. And that's why, the Gelb appliance is probably the #1 appliance in the US as a daytime appliance. Maybe all along its use really was for the airway and not what we thought was so much it being just primarily TMJ appliance. So that's what we're talking about. We're talking about mind and body, because when you get deep sleep, you repair the body. When you get deep sleep, when you're not snoring, the body releases human growth hormone. So if you want to actually feel younger and look younger, you get better sleep and it repairs the body. And then in REM sleep, we consolidate memory and we help repair the mind. And we've gotten into things like we're talking about dementia, we're talking about Alzheimer's, because airway treatment and opening the airway is part of reversing Alzheimer's and reversing dementia.
By the way, if you want to get a degree on Dr. Michael Gelb, Dentaltown has 270,000 dentists who have posted 6 million times. We have a search function on the app and the website. If you just type in Gelb, some of the most amazing threads come up by everyone talking about it, trying to teach it to each other. It would blow their mind if you'd get on there and start answering.
Okay.
If you post, well, first of all, you couldn't post in every thread that had the word your name in it, because you would have to quit your job and do it for at least a week or so. But it is, I just love it. And I'm so honored to get you on this thread because, like I say, you just don't see these long arguments and debates and endodontics. I mean, no one's talking about going back to Sargenti. No one's talking about silver points. It just seems like the endodontists figure something out and move on. And that's just not what we see in TMJ, occlusal appliance therapy. Man, I wish you'd put some courses on Dentaltown online.
I will do it. I'm telling you, I'm going to do it. I'm committed to it.
Because it is there is such a something in the market. Another popular question is when they see people grinding and bruxing their teeth, besides that having to do with airway or teeth or whatever, are there other variables involved, like their brain psychic stress or their diet or their gut microbe or their exercising or do any of those factors, or are those secondary, tertiary factors, or
secondary? Yeah.
Secondary.
So I'd say alcohol consumption and sleep apnea are the two top things. Odds ratio, those are the two top things. You put in stress, caffeine,
alcohol and what?
Alcohol and sleep apnea. So sleep apnea is really the #1 in terms of, it's like 1.8 in terms of odds ratios. How likely are you to clench and bruck? So that's why the American College of Prosthodontics is saying, if you have a patient that's a bruxer, maybe a good place to start is to evaluate their sleep, get a sleep study. Because in these chronic bruxers, the people that are just, you can't stop them, they're exhausted in the morning, they're men, they're thin women, they're petite women, they have big tongues, they have small airways. You would never in a million years think that that was going to be a candidate. There, you really are helping these people once you evaluate their sleep problem. Once they start sleeping better, you open the airway, it really calms down their bruxing. They awaken more refreshed. They awaken in a better mood. And I had a woman come in today. She came in for weight gain. She goes, you know what? I don't have those cravings anymore. So here's the thing, Harry. You wake up in the middle of the night. Are you going to reach for a pint of that Haagen-Dazs coffee or chocolate? Or are you going to maybe take a carrot or take a piece of celery? So they did a study at Cal Berkeley. People would wake up, and the center of their brain that handled cravings would go way up if they had sleep apnea, and their decision-making skills would go down. So they have a craving, and their executive function or their decision-making is poor, so they're going to make the wrong decision. They're going to go for the pint of ice cream. And the carbs are just going to feed that. They're hungry, and their cortisol's out of balance. So what we're saying is you sleep better, you feel more satiated, you're not as hungry, and it works very well, and your cravings go down.
Talk about the American College of Prosthodontics put out a paper on oral appliances.
Yes.
What did you think of that paper?
I absolutely loved it. I think it's one of the best things they've done, and I think they're going to look a lot more at Airway now. I think it's a game changer. You know, I could say it, but when the American College of Prosthodontics comes out with that, and they're saying, before you do a full mouth rehab, hey, before you do a crown, I tell dentists, you ever work on tooth number 18? You ever work on 30, 31? Well, if you contour that tooth too thick, too heavy lingually, you're affecting the airway. People say, well, I don't want to get into airway. Well, you're an airway doctor right now. Gary Cady says you're a master of the airway. We all treat the airway, Howard. We're just not aware that we do it. So when the American College says, you know what, you better look at that. And by the way, there's liability out there that if you're closing people's airway, we took a Hippocratic oath, do no harm. If we're closing someone's airway, we're really suffocating that patient. We do it slowly, and I say no one notices, right? You're killing the patient, but we're doing it very slowly so they can't pin it back to us. We have a good alibi. But it's like a Me Too movement in dentistry. You really have to start looking at the airway, or we'd advise that you do. And, you know, you're an airway doctor right now, whether you're a superhero for good or for evil, that's, you know, that we can't really say. But that position paper, if you Google it, American College of Prosthodontics paper on oral appliances, they've got a lot of good literature. It's all evidence-based, and I think it makes a ton of sense.
And that was with Dr. Jean C. Wu, Nancy DuBois.
Yes. It's a game changer.
It is a game changer. So what is Airway Centric?
Airway Centric is a way of looking at dentistry. It's a way of reframing everything that we do so that if we see a scalloped tongue, if we see wear, if we see acid reflux, the first thing we think of now when we see acid reflux, when we see that appearance of a tooth that's washed away, it's flattened out, we think airway, because the pressure, the negative pressure pulling the acid out of the stomach, we think, hey, I better treat the airway. It's when I look at a scalloped tongue, I think airway. When I look at someone who has retrognathia, if I look at someone that can't breathe through their nose, I'm thinking not TMJ like I used to. I'm thinking this patient probably has an airway problem. If I hear about a kid with ADD, I'm going to make sure their tonsils and adenoids have been looked at. And by the way, 80% of ENTs really don't get this yet. Pediatricians don't really get this yet. So we're only 25 years into this airway movement, and probably only 10 or 15 into really talking about airway. Sleep apnea was only invented by Colin Sullivan and Dement and Gimenoff probably 25, 30 years ago. So we're still relatively new at this. So when you talk about airway centric, It's a new way of looking at dentistry that really focuses first on the airway. And then, Howard, what it does, you're doing dentistry for wellness reasons. So if you start with the airway, you know, what we talk about epigenetically, a lot of us have receded jaws, narrowed palates, and occlusions are getting worse with time. So starting with kids and what you see in your adults, if you start looking at things in an airway-centric fashion, it really changes everything you do in dentistry. And it really should start with kids.
Did you see about the fossil of that ancient child they found the other day that was inside of a bird?
No, I got to look at that.
Oh,
Amazing.
did you see that? Oh my God, they found a prehistoric huge bird with a fossilized baby human in its stomach. Could you imagine birds? But the reason I wanted to think about that is the one thing that I love going outside our dental bubble and talking to other people whenever you meet them. Whenever you sit by some guy on a plane on a 5-hour flight, we find out he's something different. It's fun to just download his brain.
Right.
But it's funny how the anthropologists were the ones educating us first before the orthodontists that all these malocclusions, they pretty much just popped up a couple hundred years ago. And when you go to ASU, where they have Lucy, who's 1.6 million years old, these anthropologists say, well, all these malocclusions and everything, they just recently popped up a couple of centuries ago, and they're thinking changing diet, softer foods. I mean, instead of throwing your 2-year-old granddaughter a mastodon bone and having her chew on it or die, you know, she's eating puree stuff out of a jar. As soon as she has any difficulty nursing, they switch to a bottle and a sippy cup. So my question is, why aren't the orthodontists talking about this? I mean, how come I don't see all the local orthodontists saying, hey, if you're pregnant, come to my orthodontic office on the first Tuesday of every month, and we're going to talk to pregnant mothers about how they can change diet and nursing and all this stuff, so you're not going to breed have all these environmental factors that lead to 12 years later needing a bunch of teeth extracted and $6,500 worth of ortho. So my question is, what letter grade would you give the orthodontic community on airway-centric, airway breathing?
You want me to be honest? I'm going to give probably between a C and a D. They're probably the most disappointing profession to me. And I do applaud the American College of Prosthodontics for coming up with this. But the orthodontists, you know, they had some good teachers, right? They had Linda Aronson and Big and Ricketts and Solo and Tallgren. They had Harvold with those monkey studies. It's in their literature, but something got lost in translation, and it became a very retractive headgear, 4 bicuspid extractions. So Howard, we had this bad situation, right? We went from Neanderthal, where they had these big jaws, and they had no snoring, no sleep apnea. You described it beautifully. And then here comes Homo sapiens, small retractive jaws, the work of Lieberman at Harvard. And what do? Well, we used to equilibrate. We don't do that as much anymore. But now we take out teeth and we use headgear, and we want to pull everything back. We want to camouflage cast tooth. You know, McNamara said 85% of all maxillas are too far back. So I just really feel so bad. I feel bad for the orthodontic profession, but I'm really happy for the general dentists who have gotten into orthodontics and who are doing things. We could talk about clear aligners in a second. That's a whole nother subject. But I'm so happy with the general dentists that have gotten into ortho. And I think the orthodontists, it's really time for them to wake up. But they want to keep their ground. They want to do things just the way they've been doing them. And I'm frustrated with them. I kind of am at least second or third generation in that. My dad felt the same way. And I don't get why they wouldn't want to jump on this bandwagon. And probably what they'll do in another 10, 15, 20 years. Oh, yeah, we knew that all the time. But
and they think their issue is Invisalign. I posted last night, I don't know if you saw it yesterday, the Motley Fool came out with an article, says better to buy Align Technology versus Dentsply Sirona. Which one of these stocks is likely to bring smiles to investor faces? And Motley Fool was just talking about basically, I mean, you're in New York where they're going by the Apple Genius bars, and Align Technology owns iTero Scanner and Invisalign, and they're going right next to these. I mean, Steve Jobs was, I mean, the only thing you can tell Steve Jobs, I mean, he wasn't a programmer, he wasn't a tech guy, he wasn't anything. He was a marketer. He was a master genius marketer. And when everybody was getting out of retail and saying it's going online, he said, hell no. He opened all these Apple Genius bars where he put all of his products in the front 25% with a bunch of people, but it was nice locations, and buying an Apple is like buying a Mercedes or a Ferrari. I mean, if you walk into a bar, if we both go out clubbing and you got a Samsung and I got an iPhone, I'm the guy who'll get the dance. You know what I mean? No one's going to dance with someone that has an Android. And now Align Technology is doing the same thing. You can go to places now where no one in dentistry, some girl who used to work in a makeup booth, who's pretty in heels and knows how to sell and close, and next thing you know, she's scanning and sending that on a DICOM file to Costa Rica. They're making trays, sending it right to the patient at home. And how do you think that's going to affect orthodontics and airway when you're having makeup ladies doing the diagnosis, treatment plan, and scanning, and they're sending you the trays from Costa Rica? Do you think that's going to work? Does that have any red flags to you?
Oh, yeah. Well, I think absolutely it's going to work. It may put the orthodontist out of business. I'm not sure that it shouldn't. There is a problem, though. So if you only want to have alignment of teeth, and if that's really what the orthodontists are doing, they really shouldn't be an orthodontic profession. But if you just want alignment of teeth and you're not looking at airway and you're not looking at TMJ, you're missing the boat. So, we see patients coming in that have had just alignment. Teeth may look nice, but are the jaws in the right position? And did you take any account of their airway? See, what happens is with clear aligners, the last 2 or 3 trays, they want to make it so you could floss, right? So they close the spaces. They narrow the spaces, they close. And in many cases, when they close the spaces, I wrote an article with Bill Hang on this. When you retract, remember what I'm saying about retraction? If you're going to retract those spaces and you're closing things down, Howard, you're closing the airway. So I'd be very careful. I think it's a price point is great. And those girls that are scanning you, who's ever in there, they're doing a nice job. And it's very cost efficient. But, we want to talk about this as a medical profession. Dentistry, we're physicians of the mouth, Howie Hinden likes to say. And we'd like to see dentists going more in that direction. We're a part of medicine. This is really the best way to integrate medicine and dentistry and to get us aligned. It's the unifying theory of dentistry. So it'll take some people a little longer than others to get into it. It's also happens to be very fulfilling. And it's something that's really run largely by the dental team. So the women in the practice get it better than the male dentist. The female dentist may get it better even than the male dentist.
Okay, let's move from orthodontist to pediatric dentists. I've been a little disappointed of like 3 exact times in the last year or so where you'll be at a friend's house and I'm in Ahwatukee and this is clear over in Queen Creek, and the 5-year-old's sleeping on the couch and just grinding. It's like marbles just grinding. And I said, do you hear that? She goes, oh, it's no big deal. He always does that. And then I tried to explain to her about all this. And she goes, well, I go to a pediatric dentist. I go to the best pediatric dentist. I said, okay, well, I want you to make another appointment, and I want you to go in there not because it's a 6-month cleaning, but because he's grinding his teeth at night, and you can hear it across the room. You know what he told her?
What?
They're baby teeth. They're going to fall out. He's fine. Don't worry about it.
Right. That's a big problem. I totally agree with you. Another big disappointing group, Howard, the Academy of Pediatric Dentistry. There was a big conference that Steve Carstensen set up at the ADA last month. A lot of my friends went out there. And the American Academy of Pediatric Dentistry didn't see any need to send a representative out there. So they are definitely not on board with this airway thing. And I'm saying they're now in almost as bad as the orthodontist. So we want the pediatric dentist to get in there before 5. Kevin Boyd, who's one of my good friends and does a lot with the epigenetics and out in Chicago, he says less than 5. And when we heard Karen Bonnick, we're now even getting in there with Healthy Start or MyoBrace. We're advocating getting in there at 2.5, 3 years old. It's about, what orthodontics is about? Brain development. Orthodontics doesn't have a lot to do with teeth. It's about opening up the structures, opening up the airway, and saving these kids' lives, changing kids' lives. The time to do it is when the bone is soft And Howard, yeah, I'm with you on it. The pediatric dentists, I guess they're doing very well just filling teeth. So I think we've regressed in certain ways. You know, there's a percentage of the people out there that really get it and want to save lives and get kids off of medication, change behavior, make kids a little bit more clear-headed. And there's others that just, like you said, they're only baby teeth.
Well, big pharma is very big. And when you watch any of the news stations, if you watch CNN, Fox News, MSNBC, what percent of all those commercials are big pharma?
Right. I'm with you on that.
I mean, it's either big pharma or a lawsuit. And what's so funny is half the time it's big pharma, and then the big lawsuit is about a class action lawsuit on some medical device or whatever. And it's like,
or a drug.
Yeah, so I don't think when your news stations are publicly traded on the New York Stock Exchange, profit is the motive. It's really hard to get good information because they want to. I'll never forget when the military did an amazing thing. I mean, who could do a bigger study than the military about psychiatric medications and post-traumatic stress disorder?
Right.
And it was some of the biggest name drugs out there. I forgot it was the biggest one. And they said they saw nothing, zero effectiveness.
Right.
And immediately all the news stations are saying, oh, well, they just don't want to pay the bill. They're just trying to get out of it. They're not standing behind our soldiers. They don't want to pay for all. It's like, dude, no one in the military did this study. That's their own tribe. They're not trying to throw their own tribe under a bus. Their own tribe doctors are saying, we don't see a difference with these psychiatric pills for this treatment. And I saw it across the board, all publicly traded news companies. The talking point was the Pentagon's trying to get cheap on the vital medication that our soldiers need today. And it's like, anybody thought that maybe it just doesn't work? So I want to switch to another profession. We beat up orthodontists, pediatric dentists. Let's go to a profession where I'm not even sure if it exists yet, geriatric dentistry. It sounds like the courts, starting in Texas, have basically said there's no such thing as a legal specialty. The American Dental Association, they didn't care what their club called 9 specialties. It was about an implant case, and the Texas court said, is your practice limited to implants? And he said, yeah. And so, so he told, then what's your problem? You're a club. If you want to kick him out of your club, kick him out of your club. But he's not fraudulent. He says he only does implants, and he's an implantologist. Get over it. Well, geriatric profession, I'm a little biased about that because I'm out here in Phoenix. And I mean, within 2 miles of my dental office, I swear to God, it's 40% people who retired. If they're east of the Mississippi River, they all go to Florida. And if they're west of the Mississippi River, they all come to Phoenix. And so how is sleep apnea tied to dementia and Alzheimer's?
It's a great question. Let's see if I have my book here. But there's a book by Dale Bredesen. But we've known for a long time that it usually takes 2 paths. in kids, in middle-aged adults, older adults. Sometimes it affects the little kid. You know, there used to be the fat kid, the lethargic kid. He's a little bit overweight. And then there's the thin kid who's running around, who's hyperactive, right? So it takes 2 different paths. Well, we always knew that neurocognitive aspects of this could be one of the ramifications. So in other words, you could be irritable, or you could forget things. You could have a poor memory. Now, that's the hippocampus. That then evolves into cognitive impairment, which evolves into dementia, which evolves into Alzheimer's. So Niedergard did a great study at Rochester. He found that when you got into deep sleep, that's when the toxins were removed from the brain. And he discovered this thing called the glymphatic system, not the lymphatic, the GL, the glymphatic. And that's when our brains get scrubbed. That's when the housekeeping occurs. That's when the toxins get removed. Spaces open up and toxins get removed from the brain. So UCLA did another study, and they said when you don't sleep well, your blood-brain barrier opens up. And that's when we start talking about this oral systemic stuff. Mouths get dirtier, you get treponema, you get P. gingivalis. That's what they're discovering in the brains of Alzheimer's patients. So it's prudent that before we get to that geriatric number, like maybe in our 30s, our 40s, our 50s, we're trying to get people to prevent it. But if you want to talk about reversing Alzheimer's is number 1 a disease of inflammation. And what's one of the most potent causes of systemic inflammation? Sleep apnea. So if you want to get into anti-aging dentistry, if you want to take a drive with me to Las Vegas one day or fly in there, this whole anti-aging, this whole wellness phenomenon, I think it starts with airway more than diet. Diet's very important. Exercise, extremely important. And you can cut dementia by 50% with just exercising. But there's a huge proponent of the inflammation, dementia, Alzheimer's that has to do with getting a restful night's sleep. That's when your brain gets recreated. That's when you form new synapses. You know, I learned something from Dale Bredesen. If you talk about synaptoblastic activity, you know, like the osteoclast and osteosynapto, new synapses, that's called anti-aging. You know what they call synaptoclastic activity? That's called Alzheimer's. So when you start losing synapses, you're getting that dementia and Alzheimer's. So if you want to live longer, if you want to be healthier, if you want to keep your marbles and your memory, you got to, you know, you can't ignore it. So, you know, you get to be my dad's age. They don't want to do anything about it. You get to be 93 or 90. You got to get our parents doing things, and we have to start doing things in our 60s and our 50s.
So do you see? I mean, you're in, you know, near Manhattan. You teach at.
I'm in Manhattan. I'm in the city. I'm at 59th and Madison right here.
So you have more people in density than anyone. Are there any full-time geriatric dentists in private practice in Manhattan that market themselves as geriatric dentists?
I used to hear that when I was at Columbia. I heard that. I don't know any that are geriatric.
There's I think geriatric dentistry could be a huge thing because these retirees, they got money, and he had broken his leg. It wouldn't heal. He was 85. They said, well, that's just how it happens to 85-year-olds. And he was in a wheelchair, and he has lost his mood and his libido. And he was so pissed off. His wife was about ready to hit him over the head with a frying pan and send him on his way. And one of the neighbors said, well, you know, if you drive to Palm Springs, they got a life extension institute down there. So they drive down there, and they test him out, and he said, just basic things. He says, you have no testosterone. You have no human growth hormone. So he just pumped him up on testosterone cream and human growth hormone, which we're always focused on trying to catch the athlete that's doing it. No one cares if you won the race or made the touchdown because you put cream on your arm. Who cares? What I care about is the fastest growing segment of the American population is people over 100. Second is 90 to 100. Third is 80 to 90. The fastest decreasing population is childbearing. You know, they're having less and less kids. So he had sat in that wheelchair for 2 years. 6 weeks of doing that, he was out of that wheelchair. When he came back to my office for a recall, he got down on the floor and did 8 push-ups and was telling me that this religious mindset that, oh, you're cheating, you're taking steroids. He says, why don't they legalize all that stuff? Because while you're cracking down on all these steroids and all this stuff for athletes, he goes, have you ever thought about maybe the steroids that the Olympic athletes are taking might help your 85-year-old grandmother resume her normal life?
Right. Absolutely.
And then the other thing, it's the Mayo brothers. They were the first one where the Mayo brothers even said, they said, you know, when you're 85 years old and you've had a small grains wheat farm your whole life, and you get cancer and they say grandma's going to die, everybody just thinks, well, yeah, she's 85, she had a good life, let her die. Mayo Clinic said, are you out of your mind? They will sell the entire farm, the whole thing, to save grandma. And you look at grandma and say, well, she's 85. You're not going to sell the farm to save grandma. That's not how humans. Ask any woman with a 2-year-old, say, if your baby was going to die tonight, and the only way you could save her is sell your house, car, iPhone, all your money, fly to Scandinavia and take this little bitty white pill, would you do it? And she'll say yes every time. So I think this anti-aging should be exploding. There should be people out there in Manhattan and Phoenix and by every Mayo Clinic. Mayo Clinic only had 2 satellite offices. They went to Phoenix, well, it's in Scottsdale, and then they went down to Florida. That's where all the rich money people are, and they don't realize that these people don't want to settle for gum disease and losing all their teeth. And if you can do other things and improve their sleep and diet or gut microbiome. Did you know Mayo Clinic is now doing fecal matter transplants to
I love that. I love it.
Rejuvenate the gut microbiome?
I think that's a hot area. You know, we want people to do that, but they have to have C. diff. I want more people to be able to have fecal transplants. I think that's a huge area that's going to, if the government maybe lightens up on it a little bit, that's a huge area where people can really get help, you know, without having to suffer for years.
Well, didn't they just pass a law though that if you're terminal, you can get the medication. It was on trial. Someone just told me they finally did that. Did you hear about that?
I didn't hear it, but I think it's going to loosen up. My friend Larry Brandon Montefiore has done a lot of the research in the U.S. on fecal transplants, and it's in a pill form now. It's getting easier to get it. So I would have everyone follow that. I'm with you.
Well, the last straw for me in having any faith in healthcare in this government of ours was when I bought my house. This house that I'm living in, raised my 4 boys. This is decades ago. Poor woman had to sell her home and move to Sweden because of a drug invented in America. She had brain cancer, and she couldn't get the drug because it wasn't FDA approved. So she had to move. She's an American. The company making the drug's American, and she had to move to a foreign country because our government. I mean, I'm a libertarian. I'm a Milton Friedman economics. I think Milton and his wife rose to the greatest economists of all time. How did we get to a point where a government agency, when you say, look, I'm dying.
Right.
I mean, can't I just have the pill? No, we have not approved it. I mean, it's one thing to say, well, I'm the FDA and I'm telling you, we don't have any research on this decision. But then it's your American freedom to say, well, what are my alternatives? I mean, what else I can do? You know, essential oils. I'd like to try this. Obviously, the scientist that made this believes in it. Obviously, the pharmaceutical companies going to spend millions of dollars. I mean, I have no alternatives. And then wouldn't that speed up their R&D process? If they
totally with you on it.
That we did a clinical study of 30, but 3,000 volunteers bought it with their own money, and this is what happened to all them. So yeah, the government is too big. And they need to get out of healthcare. I remember Senator McCain. I was at a fundraising dinner with him. Senator John McCain passed away. I share the same birthday with Senator John McCain. August 29th. And I told him, I said, well, you know, you got these Indian reservations, and they exempt them from, they let them gamble. I said, why don't you have an FDA-free zone on these Indian reservations where good-paying Americans can just come here and try what they want, without Washington, D.C., 3,000 miles from here, regulating everything. And he said, oh, my God. He goes, you know, I wonder how the big pharma would talk about that. All right, my only final question, last question.
Sure.
Why the heck did you go on CNN, ABC, CBS, and Fox before Dentistry Uncensored?
I don't know.
I can't figure that out. My
gosh.
I mean, who is CNN, Fox, CBS? But hey, I'm sorry. One last 30-second question.
Sure.
You also have been written up in Women's Day. Is it true that women have more of these issues than men?
Typically, men have the issues until women get to be menopausal age. Then they catch up with us. But there's a group of people, women, very thin, maybe they've had a kid in their third trimester, and there's other very thin women that have something called upper airway resistance syndrome. They have trouble getting into deep sleep. They don't have apnea, they don't have oxygen issues, but their brain, you know how the women, after they've had a kid or two, they're always up listening for the kid, and then your kid's driving, you never really sleep the same way? These women's brains never get down. They're very fit, they're very thin, they're exhausted in the morning. They got pain all over. They clench all night. They have irritable bowel. They have cold hands and cold feet. That's what we'll talk about that in the hour segment. But a lot of women, Howard, we've been taught the wrong thing over the years. There's tons of women out there, legitimate, good women. They don't sleep well. They're looking for sleep aids. They're exhausted in the morning, and they can't find what it is. And then a lot of it, we can help as the dental industry and the dental team. I'm excited about it.
Just don't ever publish in one of those magazines that it's caused from the stress of their husband.
I will never say that.
Okay. Thank you again so much for coming on the show.
Great being here. Thank you.